so I'm sure we've got some questions. Can you dip digestive biscuits in yoghurt? Is that all right? Great. That's all I was thinking when I was seeing that slide up there. Okay, questions. Oh, one here and then.
Thank you. You may not want to answer this one. Keto diet.
Okay.
Could that be a benefit to reducing the size of cancerous tumours, or is this a bit of a myth that I've read about? I've read lots of pros and cons, and I'm still undecided. I went on to a keto diet about 6 months ago, 9 months ago maybe. I feel much better for it. Whether it's had any effect on the gist, I won't know until I've had another scan, but I'm just interested in your thoughts.
Yeah.
So you never touched on that, and
Can I just say, I think she's answered that by saying
but it's going off on a sidetrack, and it's something that's quite controversial, I believe.
Okay. Sorry?
I didn't think the keto diet was very good for the kidneys.
Yeah, so I very much advocate a fully balanced diet based on the healthy plate model. There has been some evidence of the keto diet being beneficial in some brain cancers. And the keto diet was actually developed initially for people that suffer with epilepsy. And it was very effective for certain people that suffer with epilepsy, and that was what it was really developed for. And so there's been some evidence of a benefit for some people with certain types of brain cancers, but overall, no. That you could potentially be putting yourself at risk by not having the balance in your diet. If people are overweight, it can be really effective. In reducing pre-diabetes, but we do not have enough evidence. It's a little bit of a myth that sugar in our diet feeds cancer, and I know that's widely, advocated, but it's not really a thing. Yeah.
Thank you. Imatinib is from that group of the tyrosine
kinase inhibitors.
Yeah, inhibitors. So is there any logic in reducing or excluding tyrosine from one's diet?
No, we don't have any evidence to suggest that.
Right.
Not at all. I've certainly seen no evidence. I'll be perfectly honest, though. I don't take any medication because I'm a true wild type. I'm one of those people that they don't know what my driver mutation is, and so I'm not able to take any medication, any treatment. And so I actually haven't really looked into it that much. But I would say from a nutrition science point of view, no, I haven't seen any evidence that would be beneficial at all.
Thank you.
What about sugar? They say sugar feeds the tumours. Or I've heard.
Yeah, I think I've just sort of probably covered that. No, we don't. It's not something that we advocate now. That sugar feeds tumors from our diet. The way that we use sugars within our body would not facilitate cancer tumours to grow. It's quite a complex process in our body. So whilst sugar might be used for energy inside our bodies, it's not going to be influenced by how much we consume in our diet. Having said that, we should all be ensuring that we reduce the amount of refined carbohydrates that we consume, and that is part of the healthy plate. It's really important that we make sure that our carbohydrate consumption is complex carbohydrates. If we're consuming high amounts of sugars and refined carbohydrates, then we're going to suffer with our energy balance and blood sugar control. And so I would always advocate that people really do reduce refined sugars in their diet. And certainly, if I'm looking at somebody's overall diet who's come to me and they've just been diagnosed with cancer, it's something that I'm going to mention to them. absolutely fine. That's complex carbohydrates. So yeah, naturally occurring sugars are released slowly. So from fruits, for instance, a lot of people think that we shouldn't be eating fruits because they've got sugars in, but actually they're complex carbohydrates, and they're going to keep our blood sugar balance is going to be fine, generally speaking. Yeah, just sweeties.
I've just put the healthy plate back up on there. We'll leave that on there so you can come take photos of that, because I think it might be helpful. Judith.
On the helpline, we quite often get questions from people who have just had surgery. They may have half their stomach removed, all their stomach removed, and they are losing weight. I've been there myself.
As have I.
And I think some of these rules actually can't apply when you're desperately trying to put on weight. And I do tell people that all the naughty things, like peppermint creams, actually become good things because they're high calorie, low fiber, so you can actually eat them. Whereas you can't eat fruit and veg because your stomach just can't cope initially. I mean, I'm N years after surgery and I can now eat a normal diet, more or less. But I think when you've had surgery and you're desperately trying to put on weight, which is not the problem most people have in ordinary life, but the normal rules don't really apply, at least for the first few months. Am I being naive?
No, absolutely correct. So, I had considerable weight loss after my surgery and I couldn't eat solid foods. And that was what I prepared for beforehand. I made sure that I made some really healthy soups. I put beans in to them and liquidized them up so that I'd got good protein in them. You can make broths with chicken, for instance. And so actually you can prepare for that quite well with just making really tiny amounts of good quality soups and soft food. I made rice pudding. I used yogurts and I used smoothies as well, but really small amounts. And so, there's a lot, you're not wrong. I ate jellies as well. In those early days after surgery, you just have got to get something. However, nutritional density, you still have to think about it where possible. If you at all can, just try to think about nutritional density, making sure that you've got the nutrients per calorie. But yeah, it is tough, those early days. And I definitely survived on complete nutrition drinks, 40 sip, and yeah.
Just before we go to the next question, on smoothies, I'm told that, you get a big drink of smoothie. If you were to go back to what the smoothie was before it became a smoothie and then had to eat all of that, so 5 apples, 4 oranges, 3, whatever, there's no way you'd be able to do it. Your body would stop. So I noticed you just said small amount of smoothies. Is that right? Small amounts, not a big smoothie drink, because that's overdoing it on the,
Yeah. So potentially, these really big drinks of smoothies can actually just contribute quite a bit too much sugar, because you're absolutely right. Yeah. So I wouldn't normally. Now my digestive system is playing ball. Then I always just make sure I have the actual fruit. The key thing is to try and eat the actual foods rather than consume them in drinks. But yeah, in the early days, I was adding all sorts to them, yogurt, oats, all sorts. Yeah. And we're all different as well. As our digestive systems are going to work very differently after surgery. I was very annoyed because there's a gentleman in the ward next to me who'd also undergone Whipple surgery who was sat up in bed eating toast a couple of days after his surgery. Very upsetting. And I was in over a month with gastroparesis. But yeah, anyway.
I've got 2 questions. What's your approach? What's your approach in terms of gut biome, in terms of pro and prebiotics?
Okay.
And the other question is, if we're taking imatinib or other TKIs on a daily basis, in terms of flushing out anything that the that any toxins or anything that we need to excrete through our kidneys. What's your view about intermittent fasting, where you would occasionally have a half, a fast of 12 hours, let's say, just to make sure that everything is flushed out of the system, really?
Okay. Right, the first question was about the microbiome, wasn't it? Okay, so everybody's going to be different after surgery with regard to how their microbiome, the diversity. It depends how many antibiotics we've had to have, what treatment we're on, how long we're in hospital for can affect the diversity of our microbiome. Our microbiome diversity can change if we just move to another country and consume foods over there. It's very influenced by our environment, and so a stay in hospital is going to change the diversity of our microbiome. With regard to taking probiotics, we have probiotics in our food naturally. Okay, so in cheese, in yogurts, anything that's been fermented, we have probiotics already in naturally, and in all fruits and vegetables there are probiotics naturally in them. I think it's best to check with your health professional before taking any probiotics. I certainly have taken some since my surgery, and I felt that they've helped me enormously with my gut function. But usually I would only advocate that people take them if they've checked with their medical professional first of all, because it depends how their digestive system is working and what changes have been made with surgery. With regard to detox and fasting, certainly in my cancer patient communities, I don't advocate fasting. I think we just need to be consuming regular meals at the right time with nutrient density. Our body needs balance, and it will strive to get that balance. It doesn't like starvation when it's trying to support our immune system. And so the way that we should be fasting is just overnight. Every night we should be having our evening meal and then not consuming anything until the next morning, so i.e. not snacking unless your body needs it, dependent upon your surgery and your health state. But I advocate that, we can fast overnight, that's normal, that's healthy, that's what we should be doing. But I don't think it's the time for fasting when people are going through a cancer journey. They need regular meals. As far as detoxing our bodies, that's what our kidneys and our liver are responsible for doing, and they will do that all by themselves. Just ensuring that you're well hydrated is the most important thing.
I recently started seeing a nutritionist about 3 or 4 weeks ago, and she advocates pretty much the same, but also protein shakes, a lot of it. How long do you think that's not acceptable, but sustainable for, really?
Okay. How long are you post-surgery?
So just over a year, and
Okay.
taking imatinib. So
And what was the reason that she recommended protein shakes?
so I was going in because I would not eat for long periods and then eat rubbish when I
Okay.
was eating.
Yeah.
So the idea is a protein shake in the morning. I'm at the house about 5:30, 6 a.m. most days.
Okay.
So protein shake when I'm maybe driving into London or going somewhere, just
Sure.
to start.
And
my
what
metabolism,
protein shake are you
etc.
taking?
The ones at the minute are Herbalife ones.
Okay.
With a PDM mix, which is like a high protein mix.
Okay.
And then snack, another shake at lunch, another snack, and then an evening meal of
Okay.
protein, a carb, and vegetables.
Okay. So, I mean, yeah, it depends on people's individual situations whether that's going to be beneficial to them or not. I mean, ideally, we should be getting our protein from natural foods, from, lean meats and dairy and all the other things that are listed up here. We should be getting our proteins from, ideally. But there are sometimes when we don't have access to the right amount of protein, and we need to have it with every single meal. And so a good quality protein shake is okay. We just have to be a little bit careful with consuming so much protein that it displaces other nutrients in our diet. And so this is also, around the misinformation thing. It's quite important not to be starting to remove food groups from our diet, because then it can upset that balance. So with protein shakes, I particularly like, and I'm not an ambassador for them, Huel. They have a black edition, which is a much higher protein amount. I think it's 40 grams. It's a lot to drink. It's about a pint. But sometimes, if I'm in a hurry, like this morning, for instance, I left the house at 6 o'clock this morning, and I knew I wasn't ready for any breakfast, so I actually made one for myself, and I'll make it with like half milk, half water. The reason I like their products is because that particular one, the black edition, has got really high protein in it, but it actually has tons of nutrients and fibre in it as well. So I do feel that that's as close as you're going to get to sort of a complete meal. But I'm sure there's some other good ones as well. Huel, black edition, yeah.
Hi, thank you for the reset on everything. My question is, when there are times when I just am not feeling particularly well, and perhaps can't eat as much as I need to, is it better to keep to the healthy plate, or is it better to up the calories with a slightly unhealthier mix?
Okay. It's always better to stick to the healthy plate. It's about that balance, yeah. I mean, even in snacks, I try to stick, if at all possible, to that sort of balance. Even at breakfast, that half vegetables will be half fruit. So I think if at all possible, you should stick. I think when you're struggling to eat, sometimes it is just about what you can get inside your body, yeah, to get you through the day. And so I don't think we can set too many rules around that, especially if you're having nausea for the day. Sometimes people just need to consume what works for them.
Thanks.
Sorry, that's not really...
Can I ask you a question about milk? So I've done a bit of research on milk. And what I've learned is that no animal drinks another animal's milk after weaning, even their own species. Milk causes an acidic reaction in your stomach, which takes calcium from your bones to neutralize that acidic reaction, slow over time, which is why in places where they don't drink milk in the world, there is no instance of osteoporosis. What's your view on that?
Okay. Oh, good question. It's a big question, that. I'm probably not going to completely answer it for you. In the first phase of the agricultural revolution, some 10, 11,000 years ago, we have evidence of us consuming milk products. Okay, and so certainly in Northern Europe, we've consumed milk products for a long time. Some countries and some continents didn't do that, and so in some parts of Asia, they didn't start consuming milk. But in Northern Europe, people started consuming it and have been consuming it for about 10,000 years. We haven't got any good enough evidence over a long enough period of time to suggest that we shouldn't be consuming it and that it causes osteoporosis at the moment. So there's some studies that are interesting, but we need more research. And so certainly at the moment, I very much advocate drinking milk because we've been consuming it for about 10,000 years. And obviously people are intolerant to it. So intolerance comes from countries that did not start drinking milk, our gene expression. When people started drinking milk, when we are weaned, the gene is switched off. That enables us to be able to absorb and metabolize lactase. In countries where we started to drink milk products, that remained on. It remained switched on. But those countries that didn't go through that revolution, people are intolerant because their gene switches off after weaning and they're not able to utilize lactase in their bodies, and it makes them, they're effectively allergic, intolerant to milk. And so that means that people have migrated all over the place and our genes get mixed up, and so therefore we have people in Northern Europe who are also going to be lactose intolerant. And so it's quite complex and genetic.
Yeah. So everything you've just said I've heard, but the other thing that's quite compelling is there is no evidence whatsoever of anybody that is diagnosed with osteoporosis getting better through drinking more milk. It just gets worse. So, you know, all these questions, and you know, begs the question, so if that's true, why is it we're not being told don't drink milk? Well, the reason is because it's a multi-billion-pound industry, and you know, you just can't do that. But I tested this myself. So my wife and I both stopped drinking milk for 2 months, and I was told you will find that your throat and everything will feel better. You won't get as much nasal problems. That's exactly what happened. So I now, where I can, in the main, drink plant-based milk, and it's made a massive difference to. Now, that could be, arguably, because I'm intolerant to it, but I'm told, and I've read and researched, that everybody actually, for the reasons you've said, after weaning, are intolerant to it. And all this other evidence in nature, and countries that don't drink milk have no incidence of osteoporosis, all sort of makes sense a little bit.
Yeah, it's interesting. It sounds like you probably had a little bit of an intolerance to it, because that's not across the board. Is that people would have those symptoms and then they would reduce when they're not eating. And osteoporosis, we're often genetically predisposed to developing osteoporosis as well. So it's quite a complex disease. It's not just because of the calcium that we consume in our diet. And certainly women are more predisposed when they go through menopause and their estrogen levels start to drop, because estrogen is bone protective. But actually, just milk is not the solution for bone health anyway. There's actually loads of nutrients that are important in our bone health. And so, yeah, it's interesting, but we just definitely don't have enough evidence. And so we, you know, and most people are okay with milk. Yeah, but dairy products have really important nutrients in them, and they're an important component of our diet. And so unless we have a reason...
Yes, another milk question, please.
Yeah.
I read a book by somebody called Jane Plant. Have you heard of this lady?
No.
She reckoned she had breast cancer, and then reckoned she kept it a bit away for many years by cutting out dairy.
Okay.
And some of her evidence was that it's the hormones that are fed to cows that get into the milk that can trigger off hormone-related cancers. And that in countries where they don't drink milk, the incidence of breast cancer is much, much lower. Have you heard of this at all?
Yeah, so I drink quite a lot of milk, but I always buy organic. And the reason I buy organic is because, you know, I want to reduce my chances of consuming antibiotics that might be given to the cows to try and protect them against mastitis, and any hormones that are given to the cows to help with milk production. And so I tend to only drink organic milk, if I'm really honest. One person, as I said earlier on, one person's cancer isn't the same as another person's cancer, and it's going to respond very, very differently to nutrition and to drugs. And so I certainly, I'm really careful in, you know, telling somebody to change their diet based on one person's experiences. And we don't have enough evidence to tell us to stop consuming dairy at all. In fact, it's a really, really important part of our diets.
Yeah, one final question, please. They say Guinness is good for you. If that's the case, should it be Guinness Zero or standard stuff? The sensible side of this question is, should we be careful
patients like us with alcohol intake?
The sensible answer to that is that we shouldn't be drinking any alcohol. You know, I don't want to give my liver anything else to do. And alcohol, it's toxic to our livers at the end of the day, but it's entirely up to you. Guinness Zero is better than Guinness with alcohol. I don't mind a little bit of Guinness, but I'm not going to advise you on alcohol.
Last question from Judith.
It's not really a question, it's a statement. When I had my first surgery, it was just before our Ruby wedding. I had a glass of wine and I felt so ill. 2 months later, it was Christmas. I had another glass of wine. The same thing happened. I just don't drink alcohol. And I think the evidence now is that alcohol is a poison and affects all sorts of things, not just alcoholism, but everything. And the risk of all sorts of cancers goes up if you drink alcohol.
Yeah.
So I don't.
Yeah, no, absolutely.
I'm the same. I'm exactly.
I think they used to tell us that Coca-Cola was good for us as well, though, didn't they? Wasn't it sold as a medicine to begin with? But it's a, yeah. I mean, you know, I tell anybody who comes to me who's starting a cancer journey to just stop drinking alcohol. You know, especially when you have a cancer that may metastasize to the liver.
Okay, so just the final thing I was going to say is in my I live in a little village. We get a lot of deliveries of milk and yogurt, etc. And we had a chap that used to go around and pinch all the yogurts and milks and cheeses. How dare he? Yeah, sorry, that was a bit cheesy, wasn't it? Yeah. Well, I'll stop. Right, Deborah, thank you very much.
Thank you.
Thank you for coming.
Thank you.